Jim Parsons, director of Vera's Substance Use and Mental Health Program, talks about a 2009 pilot study that adopted an innovative method for describing the life histories of women with mental health and substance use issues.
My name is Jim Parsons and I direct a program at Vera that focuses on the substance use and mental health needs of people who are involved in the justice system. I'll be talking today about some work that we've conducted on the life histories of mentally ill women who are involved in justice systems. As part of the work that we've been doing in the research program that I direct, we've been looking at the mental health needs of people who are involved in the justice system. What we found is that for women who are in the New York City jail system, rates of mental illness are nearly 3 times that for men. This finding is also confirmed by studies that have been conducted elsewhere in the country, which tend to find that incarcerated women have around about twice the rate of mental health problems as their male counterparts. This got us thinking about conducting research which looked at the pathways that women follow that lead them to be involved in the justice system. We know that many of the risk factors for mental illness and for criminal justice involvement are similar, relating to histories of abuse and victimization and drug use. However, we are interested in finding out how these kind of problems combine and how they sequence and combine to lead to women with mental illness being arrested and finding themselves in prisons and jails. One approach to gathering information on the sequencing of events is the use of a technique called life history calendars. This is a research method which allows researchers to map out different types of behavior or activities in a grid format. So it's possible to compare the sequencing and timing of different life events on the same time scale. So for example, you can use this technique to understand at what age somebody left school, whether somebody got married before they moved into their first home. And so it's a way of both mapping out events against each other and also helping interview subjects recall events which may have occurred some time ago. We use this technique to interview a group of women, asking them about the timing of a variety of different life events. Because of the focus of our research, these events included the first time they used drugs and when they used drugs regularly, when they first realized they had a mental health problem, timing of criminal justice involvement, and also receipt of treatment services and other kind of interventions, as well as some other questions about living situation, relationship status, birth of children, and these kind of issues also. We used the life history calendar to interview 10 women who were attending a drug treatment service in New York City. These women were identified both because they had a diagnosed psychiatric disorder and because they were judged to be stable enough to complete the interview with a minimal risk of re-traumatization. The questions were obviously detailed. We were asking about histories of victimization and abuse, so these were difficult interviews to complete. We interviewed women over 2 time periods, 2 sessions, each lasting between an hour and a half. The women that we spoke with, as well as having a psychiatric diagnosis, were all drug users. Obviously, we interviewed them in a drug treatment setting, and they were aged between 31 and 43 at the time of interview. First of all, we found that most of the women that we spoke with had experienced victimization in their past. All of them reported physical abuse, and half of the sample of 10 women reported some form of sexual victimization in their past. Also, as I mentioned, all reported drug use. In terms of the sequencing of events in their lives, most reported that they had started using hard drugs before they realized they had a mental health problem, on average several years before they realized that they had a mental health problem. And then for most of the sample, their first arrest happened after both they'd started using drugs and they realized they needed help with their mental health. However, despite for most of the women that we spoke with, drug use and realization of mental illness happened before they were arrested, for the vast majority, they didn't receive treatment until after they had become involved in the criminal justice system. This obviously represents a substantial window of opportunity where services which aim to provide treatment and to reduce the risk of future criminal justice involvement could become involved earlier in the lives of these women and hopefully reduce the risk that they will go on to be arrested and held in jails or prisons. It's important to note that this is a pilot study and we only interviewed a small sample of women. We interviewed just 10 people. Also, I should note that we only asked women to report those events that occurred after the age of 18. When you're looking at these kind of issues, of course, early life experience is very important. So it's worthwhile to note that as part of this pilot research, we didn't document early life experiences. Again, this was partly because we were trying out some of these methods, testing our approach, and we didn't know whether women would be able to respond to difficult, potentially re-traumatizing questions about events that occurred early in their life. However, now we have experience from this small-scale pilot study. We found that women are able to answer these questions without experiencing traumatization. In fact, a number of the people that we interviewed reported that participation in the research was actually a positive experience, and they appreciated the ability to tell their stories. We now hope to expand this work to a larger sample, to include women in a broader array of settings, including criminal justice settings, to find out if these preliminary findings are maintained when we increase the size and scope of our work.